Mr. Moylan.
Thank you, Chairman Self, Ranking Member Ramirez. I would like to thank the subcommittee for the opportunity to speak on behalf of the veterans of Guam, who have been some of the most dedicated and selfless members of our nation's armed forces. Despite Guam having the highest enlistment rate per capita in the United States and one of the highest concentrations of veterans, our island has consistently been left behind when it comes to access to resources and benefits they deserve from the VA under the previous administration. So there's an ongoing discrepancy between the number of veterans reported by the government of Guam and those recognized by the VA. This is likely due to the VA's reliance on the number of veterans registered, without considering the need for increased outreach and support to those who have not been connected to the system. We know that our veterans in Guam have sacrificed so much in service to this nation. It is our responsibility to ensure that they are not left behind simply because they live in geographically isolated territory. The failure of the VA to provide adequate staffing, oversight, and resources for Guam's veterans under the previous administration is a situation that demands immediate correction. Today's hearing is a crucial step in ensuring that the brave men and women of Guam who have served our country and are no longer neglected. We must take action to provide the support and services they have earned. For my first question, Dr. Upton, Guam currently falls under the VA Pacific Islands healthcare system, which services the largest geographic region in the country. How does VHA determine resources allocations for its facilities in the territories, which face unique challenges in accessing federal resources and services?
Thank you, Congressman, and I want to echo how important it is that we serve the veterans of Guam and appreciate their service. As you mentioned, Guam is part of that particular VISN network, and we look at the veteran population, the services they need, the location of various facilities, as well as in VA and in the community. And I would be happy, Congressman, to sit down with you and that VISN leadership to talk about the needs in Guam from a healthcare perspective. I know that it sounds like we can do better and they need support, and I'd be happy to work with you.
Thank you. Next question, let me for Mr. Radaway, how much oversight exists when issues arise in Guam and the other territories? How often are visits conducted, and how does the VA address these matters?
So I can only speak to oversight of the senior leaders. I don't have numbers for you on how many investigations we've had in Guam. I can certainly get those numbers for you, Congressman. But if we receive allegations, we would treat those just the same and investigate them just as we would any other VISN or facility.
All right, thank you. And last question, Ms. Tirrett. A consistent issue brought forth by my constituents is how does the VA decide where staffing is needed, and how is the annual review conducted to determine if staffing needs to be increased?
Congressman Moylan, thank you for that question. In terms of the staffing resources and models that the Veterans Health Administration uses, those are assessed on an ongoing basis. We publish data on a recurring basis. On a monthly basis, we publish a public-facing report that looks at staffing levels. And then on a quarterly basis, we report on the Mission Act 505 section with respect to our vacancies and our staffing levels. Where those staffing levels need to be adjusted, I think as Dr. Upton mentioned, that local leadership will work with their VISN leadership to make sure that they're getting the resources and the budget and the allocations that they need to ensure that the services are being provided in a timely and high-quality manner. So those assessments are ongoing. If there are any circumstances that you want to discuss specifically in your area, glad to take a closer look at that with the VHA HR team.
I appreciate your time and all coming and testifying before the subcommittee. Thank you very much, Mr. Chairman. Thank you.
Thank you. I want to thank the witnesses for coming today.